I'm Melissa Odom, and I'm the Share Coordinator for the Share program at Baptist Health Little Rock, which is a program for pregnancy and infant loss through the first year of life. I think the main thing that I want people to know about our Share program is that we take care of these NICU babies and these labor and delivery families and these babies who pass away in the hospital. And we do everything we can for them inpatient, and we make incredible mementos. But I don't want them to forget that we're there for them long after they leave here. We have our support groups, and people come. They can come every month, they can come sporadically, and they can come for as long as they want to. And the other thing that is unique about us is we do not limit it to people who were inpatient here. It is open for the community. This is a community service. So people who have delivered at sister hospitals, people who have delivered in other cities, people who, I recently had a baby that passed away of SIDS in a different sister hospital, and they received our information, and they now come to group. We are here for inpatient and outpatient follow-up for as long as we're needed, and that's just different for everybody. The people that I see multiple times in the hospital are the people who will have the strength to come to support group, because that's a really difficult thing for a lot of people to step out of their home and step into a room full of people they don't know and open their hearts. I really try to make sure I see people throughout their stay so that they can gain that trust. And then, usually the question is, when I'm telling them about support group, is, will you be there? And I'm like, yes, I will be there. And I have 2 nurses currently who are very dedicated and help me and do support group with me, and so that we always have familiar faces so that support group never gets canceled, and they get that consistency of caregivers and that consistency of the meetings always happening. And it's kind of a running joke in support group, because I always say, this is not AA. You don't have to stand up and introduce yourself. You don't have to tell, you're going to do what you're comfortable with. And then I have patients who say, oh, but Melissa, this is like AA. I can't miss a month. They're like, I depend on it. And so it's interesting in that way. And we offer 2 groups. We do one group that is our support group that is open to everybody that has had a loss up through a year. And then we do a second support group that we started for those who are considering pregnancy after loss or who are currently pregnant, because that is something that the outside world does not understand, the stress and anxiety that comes with that. It's very difficult for these people who have lost a baby to then get pregnant again, and the people in their life are so happy and so excited and so congratulatory. And their thoughts are, have you forgotten my baby? Do you understand how scary this is for me? I don't know that I'm bringing this baby home, because they no longer have that comfort of a naive pregnancy. They just have to go on faith and go on hope that they're going to make it through and bring home a healthy baby, but they know that's not guaranteed. And so we just try to help them through that.